Good morning, everybody, and welcome to the OPT Network. Our guest this morning is an amazing woman who has overcome so many obstacles, and I want to introduce you to her. She's no stranger to the OPT Network. Her name is Dr. Sheri Prentiss. Dr. Sheri is a proven visionary, author, and a highly sought-after physician leader. She is a board-certified occupational and environmental medicine physician, public health expert, and a breast cancer survivor. And here's what we know about breast cancer, according to the statistics. Of March 2017, there are more than 3.1 million women with a history of breast cancer in the United States. And that includes women who have been treated and who are being treated. Dr. Sheri is also the author of When Everything Changed. Joining us all the way from Chicago, Illinois, we welcome Dr. Sheri to the OPT Network. Dr. Sheri, good morning and welcome back.
Good morning, Carlette. How are you?
Grateful. I know that a lot of people probably might not remember your story, so I just want to refresh all of those people about the incredible book that you wrote, When Everything Changed. And for our listeners and viewers, just as a backdrop, Dr. Sheri was a physician and lived to be a physician, and then everything changed. Tell us about that moment.
That moment was October 1st, 2008, when I found a lump in my right breast. And at the time, my mom was terminally ill. I was caring for her along with my dad. I had been recently separated from my first husband. My two daughters were living with me. So it was a lot going on in my life. I was also managing, I think at that time had to have been 18 different occupational and employee health facilities across the city of Chicago. And my world just absolutely changed. The moment I felt the mass, I knew that it was cancer. I'm a woman of faith, and so it's not that I was being pessimistic. It's just that I know my body, and I had had a negative baseline mammogram that February, and I was just, feeling my breast like I do on a regular basis. And then I found the mass, and subsequently I underwent a partial mastectomy of my right breast. They removed 16 lymph nodes, 3 of which were positive for cancer. I then underwent 15 rounds of chemotherapy and 33 treatments of radiation, and all while only missing 3 days of work.
Wow. And so you say, when you say that you knew, was it the doctor in you that took over when you felt your breast and you just knew that this was cancer?
Quite honestly, I think that it was the patient in me that knew. Because I've heard that story from so many other women that as soon as they felt it, they knew. I just knew when I felt it that it wasn't there before. And because of the experience, I think, that I have as a physician, I just knew what to do. So, I immediately called the woman who became my breast surgeon. She's a nationally known breast surgeon. And I had referred other patients to her. And I always knew, I'm like, man, if I was ever in a situation where I needed a breast surgeon, she would be the one that I'd call. So I called her at home and immediately told her, I found a mass. What do you want me to do? Diagnostic mammogram, MRI. I mean, I was on it. She was
so like, you start writing your own treatment plan.
Yes, I did.
and so at that point, when you call her and you know that this is not normal, and the patient in you, as you say, takes over, and then you start planning as we do as women on what are the next steps. Talk about what happens after surgery and how that will ultimately or has ultimately changed the trajectory of your life.
Yeah, well, after surgery, starting chemotherapy, they were very aggressive with me. I was just a few weeks shy of my 41st birthday. I was the only person in my family to be diagnosed. I was healthy. I had no other health conditions prior to that. So they wanted to be really aggressive with this to make sure that there wasn't a recurrence and that I could get as close to a cure as possible. So the chemotherapy I had was no joke. I mean, my hair literally came off of my head. It didn't come out. It just lifted off.
Wow.
And, neuropathy set in. And then with the radiation, you're dealing with...
And for those people who don't know, tell us what neuropathy is.
Neuropathy is where you experience nerve damage and you feel pins and needles or numbness, primarily in your hands and feet. It causes more of a peripheral neuropathy, and that can be very uncomfortable. You learn to live with it because, again, something about getting through that cancer diagnosis, somehow or another people feel that all of the complications or the side effects of treatment are to be poo-pooed away, just be thankful that you're alive. And quite honestly, when I was going through it, that was how I felt. I was thankful I was alive. So I got through the neuropathy. I dealt with it. I went through the radiation. I was tired every day, but I still did my job. But then after about a year of radiation, lymphedema set in. And
tell us what lymphedema is.
Lymphedema is permanent swelling of the affected limb. So what happens is your lymph nodes are part of your immune system, and they help control inflammation and infection. Well, between the surgery, then removing 16 of my lymph nodes in my right armpit, and the aggressive radiation, it destroyed all of the lymph nodes in my right armpit. And so now I suffer from constant permanent swelling of my right arm, hand, and fingers. And as a result, I have to wear compression garments on a daily basis. And the swelling was so severe that it disabled me from performing the clinical aspects of my job, my career, the one that I've wanted ever since I was 2 years old. And that was difficult.
That was to be a surgeon, and that's what you were.
Exactly. And I didn't do too much surgery. Being board certified in occupational and environmental medicine, I did some surgical type procedures, which was the most fun for me. Sewing up lacerations and removing foreign bodies from the eye and taking care of welding injuries and just that actual laying on of hands, if you will. That just brought me so much joy and fulfillment. And to now have that taken away was devastating to me.
When did you know that you wouldn't be able to go back to being a physician?
I knew the final word came December 10th of 2010. That was the final word. I went through every surgical exploration about doing lymph node transplants, and we went through whether or not compression devices, pneumatic compression devices would be good for me. They found out that they weren't. And so with being relegated to wearing the compression garments, although they control my swelling and decrease my chances of having infection and other lifelong chronic conditions, the compression garments themselves are so tight that I cannot do fine manipulative movements with my right hand, and I'm right-handed. And so although I can do the administrative part of my job, to take away that personal contact with patients, man, I was depressed. I went through a period of depression. And during that depression, I just asked God, I'm like, man, I lived and I'm here. And now what I've always wanted to do all my life is taken away from me. What is it that you want me to do? What is my purpose? And right when I said that prayer, I got a call from my boss at the time, and he had me to come into the office, and I'm like, oh my God, Lord is working something out. And he pulled me in his office and he said, Sheri, a physician who is not clinically capable is of no value to me.
Wow.
And I thought...
And he's talking about you.
Me!
You think, who are you talking about? You can't be talking about me.
Me? I have no value? Wait a minute. I got 17 initials behind my name. I've worked and trained for this all of my life. There is so
17 initials.
17? Are you kidding me?
Wow.
But you know what, Carlette? Having been through everything that I went through, I was broken. And I wanted to tell that man off In my head I did, but my heart was broken. I couldn't say anything. And I'm like, Lord, I prayed that prayer and I thought this was my answer. What in the world am I supposed to do?
But God,
And
hold that thought, Dr. Sheri.
go ahead.
Hold that thought. We're going to get a break here, and we're going to talk about how what looks like loss could
Yes.
absolutely and actually be God changing our direction, our passion, and our purpose. Stay on point. We're back right after this. Welcome back, everybody, to the OPT Network. Our guest this morning is Dr. Sheri Prentiss, and we're talking about her journey when everything changed and how what looks like decrease could actually be an increase. And Dr. Sheri, before we went to break, you were talking about, you prayed this prayer and you know that God is not yet through with you because you have survived the therapy, you have survived breast cancer, but your supervisor says you're really not of value to us. Talk about that moment and how you process that.
That moment was very difficult. My heart was broken. I was scared. I had spent my life training and practicing and being a physician. I did not know how to be anything else. And I remember going back home and I prayed the prayer again. And I told the Lord, I thought this was my way out. What is it that you want me to do? And a few days later, the Lord revealed to me that I had spent the first half of my life really just existing. I took care of people. I took care of patients. I took care of my family. I did what I was supposed to do. And I received joy from that. But I wasn't experiencing life. And God told me, he said, Sheri, I want you to live. And I didn't quite understand what that meant because I thought I was living before. And then subsequently, it was a few more days of me staying in prayer that the Lord revealed to me what live means. And for me, live means to love myself and others, to inspire those around me, to voice my dreams and ambitions, and finally to enjoy life. And when the Lord revealed that, all of a sudden, a couple of days later after that, I get an email from Susan G. Komen. They had sent out this mass email to everybody who had participated in a 3-day event from years past, asking, could you be the next national spokesperson? And I'm like thinking, well, I don't have a job anymore, so maybe I could. And lo and behold, to make a long story short, I have spent the last 6 years as the national spokesperson for the Susan G. Komen 3-day event. And it opened up doors for me to travel across this country, ministering to hundreds of thousands of individuals, listening to their stories, sharing my testimony, allowing them to see me as a physician and a patient, having gone through some of the same similar struggles that they have, to let them see that there is light at the end of the tunnel, that there is blessing on the other end of that trial and that tribulation. And although we're not thankful for the breast cancer, we were thankful through it, and that God can give you strength through it. And after serving in the role of national spokesperson, Komen approached me earlier this year and asked, would I be willing to transition into a new role, and that is as their first African-American National Health Equity Initiative ambassador, addressing health equity across the country. And I quickly and without a doubt told them absolutely. I felt that work is going to allow me to do the legacy living that I wish to do now, something that's going to have generational impact. And again, stretch out this purpose of mine that God has given me to impact lives, to make a difference in lives, and to make a change, especially in African American women. African American women can be diagnosed at the same rate as white women, but we die at 40% higher rate.
40%.
That cannot be 40%.
And so
Yes.
have the studies shown us or told us why African American women are dying at almost 50%, an alarming rate?
Absolutely. Yes, studies have shown that it is multifactorial, and it depends upon where you live, which factors are impeding your health the most. So some includes access, some includes insurance, some includes myth and cultural misunderstandings, some includes socioeconomic, and some includes how individuals perceive their faith-based relationship. And sometimes how you receive the news and where you receive the news of getting screened and knowing your health risk and makes a difference in whether or not that individual receives that call to action.
Wow.
And so one of the beauties of this particular health equity initiative is that we're now taking a multifactorial view. So it's not, you're going to see different marketing materials. You're going to see us addressing our communities different. One of the things that I've been shouting for 7 years now is an organization cannot put out universal marketing materials and expect to hit all classes, because we receive and process information quite differently. So I think having a face that looks like us and that sounds like us will be imperative to getting women for this, to take a call to action, receive that call to action, and actually take charge of their health.
And so do you think that a lot of what's happening, not only to African American women, but to all women, is the fear? You know I have felt fear, and since we've last spoken and started on this journey, I've lost at least 3 to 4 sister friends from breast cancer, and that fear of dying and the fear of the unknown. How do we help women of all cultures and all races to tackle that big elephant? Because, I mean, you've had to tackle it yourself.
I did. And as I shared with you earlier off air, I have to go in for a bone scan tomorrow morning because of a lot of bone pain that I'm experiencing, and I'm dealing with that fear as well, but I'm going in. One of the things that I tell women is, you can be afraid, but you got to learn how to do it afraid. And that it may be going in for your mammogram, going in and getting your chemo, going in and getting your radiation, sharing with your family your health history. Because the reality is this: even if you have cancer, breast cancer, any kind of cancer, you not knowing is not going to prevent you from dying, but is actually going to cause you to die faster, because you can get treatment. Would you really want to have your family, your children, your husband, your sisters, and your brothers not prepared? Would you not want to be prepared and have your relationship with the Lord, or your broken relationships in your life fixed before you were to go? Wouldn't you want the opportunity to expand the quality and the quantity of your life if you had the opportunity? So don't allow the fear of knowing to hinder you. And I tell this particularly to my faith-based sisters, because faith cometh by hearing, and hearing by the word of God. So if we know that ultimately He is our healer, why are you being afraid to know? And why would you not go through treatment when you know that He ultimately is your healer and your provider? So you can't speak to me about faith, because faith without works is dead. And your works is going and getting screened, going and following up on those test results, getting treatment, doing what you're supposed to do, eating healthy. Those are the works that build your faith.
That's
Plain and
powerful.
simple.
That's powerful.
Yes.
Let me get a break here, Dr. Sheri, but when we come back, I want to speak to those women as we are heading into October, those women of age 40 plus who have never had their first mammogram, and those younger women that we are seeing that are now coming down with breast cancer, and many of them dying. What we need to know. Stay on point. We're back right after this. Welcome back, everybody, to the OPT Network. Our guest this morning is Dr. Sheri Prentiss. She's the National African American Health Equity Initiative Ambassador for Susan G. Komen. And here's what the statistics say. Dr. Sheri, in 2017, an estimated 252,710 new cases of invasive breast cancer are expected to be diagnosed in women in the United States. That's a lot of women.
It's a lot of women. A lot of women. And here's the deal. Of those, if we don't work aggressively to decrease the disparities between African American women and white women, 40% of those African American women that are diagnosed will die. They will die. And the reality is this: when you join this sorority of women who now we're called breast cancer survivors. And let me also address those women, the metavivors out there, the women who are still walking that line between patient and don't really call themselves survivors because they're living with stage 3 and stage 4. That is a group that I have taken on near and dear to my heart, because sometimes I feel guilty calling myself a survivor, and my sister is sitting right next to me, and she's getting chemo every week still with stage 4. But one of the things that I can tell you that we experience, that 252 additional thousand women that will join this sorority, if you will, this family of survivors in this year, your life is forever changed. Your viewpoint, the way you treat your family, the way you treat work, the way you see life, the way you view trees, the way you view the sky, the way you eat, everything about you changes. There are some people that come through this journey changed and bitter. They are angry and they feel slighted, and they come off very self-centered, like I've got to get all that I can, and I'm angry and I'm mad with the world. But thankfully, I believe the majority of us come through it being more selfless, more giving, more free, and have decided that every day, every moment is precious, because it was almost snatched away from me. And I live with the fear way back in our heads. It's not fear that cripples us, but it's always that fear that, is it coming back? Will it recur? What other complications will, occur? With me, my neuropathy has gotten much worse. My lymphedema has gotten much worse.
Wow.
But because of this journey, I said, you know what? I know I'm not the only one. I got to do something. I got to wear these garments. They have to be replaced every 6 months. They're not covered by insurance. There are other women out there that are not as blessed as I am financially. What about the uninsured and underinsured that can't even cover garments? What can I do about that? So I started my own nonprofit.
So you decided to do something.
Yes. And you know what? I think prior to this, I would have been a little bit lax, because just taking care of patients, I was thinking that I was meeting my social responsibility. But now there was something elevated for me to do that would reach the masses. That 3.1 million that you mentioned, 40 to 42% of those individuals that underwent surgery and or radiation will develop lymphedema over their lifetime. So you're looking at potentially 1 million individuals now living with lymphedema and not covered by insurance for their compression garments. So now livetoday.org, at live-today.org, or the Live Today Foundation now provides free compression garments to women who are uninsured, underserved, so that they can take care of their better health.
Wow. And that's something that I know a lot of women didn't know. And do women, Dr. Sheri, with lymphedema, do they know that they need that compression garment?
Some do, some don't. So part of the other contribution that the nonprofit is doing is, one, we're educating physicians and other healthcare professions. As physicians, oncologists, my oncologist, both of them, my medical and radiation oncologist, told me that lymphedema was a potential side effect. But I don't think they truly understand the severity. Again, with us, Carlette, hey, you survived breast cancer. So whatever the side effects are, just be thankful you're alive. Well, that side effect took away my career. It affects you how you when you're donning an ugly garment every day, is reminding you of your journey through breast cancer. You feel ugly. You're already dealing with new self-image issues with surgery, and now you got to wear this. So not only am I providing free compression garments, but I design my own garments, pretty garments that are fashionable.
Yes.
So they're not only functional, but they're fashionable. And most patients don't realize that they should be wearing it. And again, the ones that do, they don't want to wear the ugly ones.
Right.
So we got pretty ones for them. And then physicians need to also understand that it affects them financially, it affects them sexually, it affects their image, it affects what clothes you wear, because you can't do little buttons. It affects how you wear your hair. It affects what you cook. You can't make those big batches of cookies anymore because your arm is heavy. All that. So we educate both the medical profession as well as the lay public on the effects, on the benefits of getting treatment. And then in addition, our call to action is, here, let's hand you your treatment. You look good in it, you feel good in it, so take care of your health. Don't lose your life to lymphedema when you made the effort and battled through and won the battle for breast cancer.
So, Dr. Sheri, that's absolutely amazing. And with the numbers and with the statistics constantly growing, what do you say to that faith-based community that sits on the pew every Sunday, every Wednesday or Thursday for Bible study, and have not, at 40 plus years old, had a mammogram? What do you say to invoke in them that they need to have a mammogram?
I say, shame on you. God is not pleased. God, the word tells us that there are times when man hath need of a physician. And when you know to do and fail to do, to you, it is accounted as sin. We as women sitting on those pews, we have an obligation to our sisters, to our daughters, to our mothers, to know our health status. If you don't go in and get your mammogram and you miss being diagnosed early, one, you are decreasing your opportunity to live out the years that God had intended for you to live. Shame on you. You're taking those years away from your family. But in addition, your sister or your daughter could have also gotten in and gotten checked. You need to be the example. We need to stop expecting that we can continue to live in a sinful world and have the consequences of our current diets and repercussions of the pollution in the air and all the contributions that go into making mutations in our cells to cause cancer. We need to stop thinking that we can live in a sinful world, but yet, we're just going to sit back and God is going to heal us. God has given us the opportunity to do the things that we can do so that we can step back and allow him to come in and do the things that we can't. Now, what we can do is get up, go get a mammogram. We can follow the instructions of our physicians. And then after we've followed all the instructions and gotten all of the treatment is not a guarantee, but your God is. So after you've done everything that you can do, then you stand. Then you allow God to allow the medications to work, to open up your understanding, to open up your mouth and share your story so that people can know that they are not alone and that they can get the help that they need. We got to stop sitting on the pews and expecting that God is going to come in and heal us and remove all sickness and disease when God has already told us, man that is born of a woman hath but a few days and they are full of trouble. Don't just get pinned in on one scripture and not take them all. So
Absolutely.
You need to get up off the pew and be an example.
Yeah. We need to be our own best advocate. Dr. Sheri, before you've got to go, let people know how those women who have lymphedema, who are in need, somebody saying that is a blessing to me, how they can connect with you and the amazing work that you are doing.
Yes, women can actually go out to live-today.org and they can find out all the information they need on the website. They can additionally email us at livetodayfoundation@gmail.com, and we will take it from there.
Dr. Sheri, thank you so much for the work that you're doing, the heart that you have for women, and for being the game changer that you absolutely are. Thank you so much.
Thank you. You're an absolute blessing.
Thank you so much. Hey, everybody, stay on point. We're back right after this. Good morning, everybody, and welcome. I'm Carlette Christmas.
And I'm Glenda Stock, and this is our final point today on Point.
Glenda, our guest this morning is one of those phenomenal women who, as we say, no woman wants to be in the sorority of women who have breast cancer. But sadly, the statistics tell us that more than 250,000 women this year alone will be diagnosed with breast cancer. And Dr. Sheri was one of those women diagnosed 9 years ago, and her life simply sort of fell apart because, as she said, she had been wanting to be a doctor since she was 2 years old, had lived this dream, only to find out that after having the surgery, after being diagnosed, that she would no longer be able to be a physician. And so her calling now became really educating and connecting with other women who have breast cancer.
Sure, her story is so compelling and heartbreaking. You know, when you look at a lady that has devoted her life to a profession that we know is not easy to begin with as a female, and then to have these tragic results come to her that causes her loss of her arm and the strength and neuropathy that she needs in order to perform her job as a physician. But it also makes you realize that, again, what we think our calling is sometimes is so different over what this higher power in our lives tends to make it be. And so we applaud her for her courageous step of listening to that voice and taking, yet another avenue. But she's filled with information, I think, about the preventive things that need to occur in ladies' lives. And we're all so guilty of thinking it won't happen to me, it will not be my diagnosis. And, we just have friend after friend and relative after relative that we know that is not the case, even with all of the research that has been done, and goodness knows we're grateful for all of that and the discoveries that they have made. But still, that self-examination, which she herself was absolutely how she actually first discovered of her situation.
And in that mind-blowing that she discovered, and she said to herself, and then she called a friend who was an oncologist, and she said, "I found a mass." And when I said to her, "Was that the doctor in you?" she says, "No, that was the patient in me."
Wow.
And how important it is for us to know, as Angie Roberts said so many times, know our normal so we know what's not normal.
And Angie's another perfect example of being in the medical field and working with women day in and day out and patients that were plagued with this horrible disease. And I know beyond a doubt the shock to her and her family to have this diagnosis come to her. But it just, again, rattles us to a state of awareness, and should, that, any day could be your day.
That's right.
And what are we doing to educate ourselves and be in that preventive mode? Because we do also hear time and time again, the earlier detection allows a much greater opportunity for recovery and better results.
Absolutely. And I know one of the things that Angie Roberts in heaven would be proud of is the work that Dr. Sheri is doing with lymphedema. And that was one of the main things that Angie dealt with every cancer patient on, was lymphedema. And what we know from going through the journey is that a lot of women are unable to afford the sleeve, the compression sleeve that's used to keep down the swelling. And one of the callings that Dr. Sheri has had throughout this journey is to create, as she calls, beautiful, dainty diva sleeves for women, because a lot of women have to wear those on a daily basis. Insurance doesn't necessarily provide for every woman, and they're not inexpensive.
An amazing effort on her part to reach those ladies, and she can so strongly identify with what those needs are, and what a gap that she chose to step in and fill that desperately was needed. But again, just a story of courage, a story of heartbreak, a story of turning her lemons into lemonade as best that she can. But beyond all of that, her unconditional and unselfish act of really taking the disease that was given to her and finding a way to translate and make it better for others. That to me is the story of a true hero. That is someone who absolutely understands the walk and is committed to making the walk much better if they can.
Absolutely. And one of the most important things that I don't want to leave this conversation without saying, Glenda, is that there is a huge disparity among African American women. 40% of those women
staggering
will die. Alexandria is number 2, or our state is number 2 in deaths. Yes, in deaths. And that's one of the real big pushes when we first started having the race here, is because so many women of color, more specifically African American women, were dying either from late detection, no detection, or lack of treatment and care.
Well, and as you and I have talked so often about, one of our causes being that opportunity for women to have the mammogram and
that's right.
Have that mammography treatment available, because it's not inexpensive, and it's not something that people with limited means are probably going to plan in their budget.
Right.
So, but yet it's so mandatory and so needed at critical stages in our life, and yet and then again we reiterate the message that we have heard over and over, time and time again. Take the time to examine yourself. Take the time to notice differences in your body, and take the time to take care of yourself. And too often women particularly are going to shelve that and not necessarily put that first and foremost, because we know there's other demands on all of us. But the criticalness of doing that so that early detection can be your story, God forbid, if it should be your diagnosis.
Absolutely. And here's what we really want people to understand, is that we must, and Dr. Sheri talked about this, move past our fear. We have to, she said, faith comes by hearing, and hearing by the word of God. But faith without works is dead. And we have too many people who have not had the first mammogram. And this is not condemnation, this is information. And so if that's you, we want to encourage you to reach out to, there are so many resources where if you don't have insurance, that mammograms are provided for you. And for those women who have a family history, reach out. Yes. We're out of time for now. I'm Carlette Christmas.
And I'm Glenda Stock, and this has been our final point today on Point.
Stay with us, everybody. We're back to wrap up right after this.